So, what exactly is the muscular system? Well, it's made up of three main muscle types. The skeletal muscle, which attaches via tendons to our bones. Then we have the cardiac muscle, which is only found in the heart. And smooth muscle, which lines blood vessels in certain organs like the intestine and uterus. The muscles in the body support movement, help maintain posture, and circulate blood, and other substances throughout the body. But the main function of this particular system is movement. It helps stabilize joints, maintain posture, and generate heat during activity. Let's dive a little deeper into the anatomy of the muscle. Like a lot of other things, muscles are made up of lots of smaller parts. So, let's start with the muscle fiber. The muscle fiber is really just a muscle cell, also known as the building blocks of the muscles. Then, multiple cell fibers join together to make fascicles, and then a group of fascicles make up muscles. Now that we know a little bit more of the background, let's look at the three main muscles. The skeletal muscle, which is also called the voluntary muscle, is attached to bones by tendons, and they produce all of the movements of body parts in relation to each other. Unlike the smooth muscle and cardiac muscle, the skeletal muscle is under voluntary control. When it comes to the cardiac muscle, it's similar to the skeletal muscle, but it is not under voluntary control. Instead, it has rhythmic contractions. The smooth muscle differs from the other two muscles because it doesn't have microscopic lines. The smooth muscle is also called the involuntary muscle. Now you know all of this, you may ask, what would happen without the muscular system? Well, without muscles, humans simply couldn't live. While the primary job of muscles is to move the bones of the skeleton, the muscles also enable the heart to beat and constitute the walls of other important hollow organs. When the nervous system signals the muscles to contract, groups of muscles work together to move the skeleton. This leads us into how muscular dystrophy is related to the muscular system and muscular dystrophy by itself.
Muscular dystrophy is a group of diseases that cause progressive weakness and loss of muscle mass. Abnormal genes interfere with the production of proteins needed to form healthy muscle. Usually, this condition appears between the ages of 2 and 16. However, it is also possible for it to appear as late as age 25. Children with this diagnosis gradually lose the ability to do activities such as sit upright, breathe, walk, and move their joints. As this condition worsens, it can lead to the weakening of important muscles, such as the heart and the lungs, leading to life-threatening situations. There are a couple of different types of muscular dystrophy, ranging from mild to severe, and they each affect a different set of muscles and cause different degrees of muscle weakness. The first kind is called Duchenne muscular dystrophy, and it is the most common and most severe form of muscular dystrophy. It gradually makes the body's muscles weaker. The weakening of muscles for this type usually begins in the hips, pelvis, and legs. The second kind is called Becker muscular dystrophy. This kind causes less severe symptoms than Duchenne MD. It usually appears later as well, around the teen years, and also progresses more slowly than Duchenne. The third type is called myotonic dystrophy, also known as Steiner's disease. This is the most common adult form of muscular dystrophy, although half of all cases are diagnosed in people under 20 years old. The main symptoms include muscle weakness, myotonia, which the muscles have trouble relaxing once they contract, and muscle wasting, which means the muscles shrink over time. The fourth kind of muscular dystrophy is called limb-girdle muscular dystrophy. This type of muscular dystrophy affects boys and girls equally. Symptoms usually start when kids are between 8 and 15 years old. This form progresses slowly, affecting the pelvic, shoulder, and back muscles. The severity of muscle weakness varies. Some kids have only mild weaknesses, while others develop severe disabilities and as adults need to use a wheelchair. The last kind is called facioscalopohumeral muscular dystrophy, and it can affect both boys and girls. The symptoms for this type usually appear during the teen years. It tends to progress slowly. Muscle weakness first develops in the face, making it difficult for a child to close the eyes, whistle, or puff out the cheeks. The shoulder and back muscles gradually become weak, and kids have trouble lifting objects or raising their hands overhead. Over time, the legs and pelvic muscles also may lose strength.
Currently, there is no treatment available to stop, prevent, or reverse any form of muscular dystrophy. Instead, there are many types of therapies and medications available to aim and treat the various problems and obstacles resulting from muscular dystrophy in order to improve the quality of life for those patients. Some examples are physical therapy, respiratory therapy, speech therapy, occupational therapy, corrective surgery, and drug therapy. Physical therapy can help keep muscles flexible and strong. Physical activity and strengthening exercises are highly recommended. Respiratory therapy can help guide treatment with weak respiratory strength. Many patients require assisted ventilation. For speech therapy, patients who experience weakness in the facial and throat muscles may benefit from learning to slow the pace of their speech by pausing more between breaths and also by using special communication equipment. Next, occupational therapy can help patients relearn movements and ability as physical abilities may change. Occupational therapy teaches patients to use assistive devices such as wheelchairs. Lastly, for corrective surgery, many patients require surgery to treat their conditions that result from muscular dystrophy. For example, people with myotonic muscular dystrophy may need a pacemaker to treat their heart problems or surgery to remove cataracts. There are also certain drug therapies that allow for medication to slow or control the symptoms of muscular dystrophy.
Muscular dystrophy can affect people's lives in many different ways. For some, it may make it harder to obtain a job, find a house or apartment, and even access certain buildings if the person is a wheelchair user. People with this condition are also more prone to getting sick due to their immune systems and have a higher chance of developing pneumonia due to the weakness of their lungs. Please keep in mind that even though they might have more obstacles in their day-to-day life, individuals with muscular dystrophy are able to live independently and adapt their way of living to their own individual life. This grants them with the power to take control of their own life and fill it with things that they find important and meaningful, as well as giving them a supportive community where they can make lifelong friends. Muscular dystrophy is a condition that heavily affects your life, but can also grant you with amazing opportunities to connect with others and relate to a very tight-knit and helpful community.